Yeah, I wanted to play some JFK. It's you know I've been playing a lot of FDR lately. Oh, and just a quick plug here before I get into it. Last Leper in the Colony: An Atheist Runs for Congress in the Bible Belt by Wayne LeGros, MD. It's a fascinating book by a fellow that Louise and I met here in D.C. a couple of weeks ago, and he's the it's the story of his running for Congress as an atheist. It's a fascinating book. Anyway. Back to JFK. John Kennedy addressed the Liberal Party. Yes, there is such a party. It's in New York State where they have fusion voting. So if you vote for the Liberal candidate, you're also voting for the Democrat because you can, you do the same two at the same time sort of thing. And he starts out talking about David Dubinsky. David Dubinsky was the former president of the International Ladies Garment Workers and Union, the ILGWU. Look for the union label. Those of you old enough to remember those ads back in the 60s. And was one of the founders of both the Liberal Party and the American Labor Party. So JFK is addressing the Liberal Party. They're actually their labor faction. There's the Trade Union Council is what it was called. In New York City, and he's pitching Medicare. You'll recall Lyndon Johnson, those of you old enough to remember, it never gets talked about in our media, but basically the way that Lyndon Johnson got Medicare and arguably the Voting Rights Act, and although that's far more complex, but we'll keep it to Medicare. The way he got Medicare pushed through Congress was by saying this was the great dream of John Kennedy. You have to fulfill his legacy. And so this is a part of John Kennedy's pitch, his sales pitch for activism and for Medicare. And he starts out by acknowledging David Dubinsky. So I just want to share, I'm going to break this up. It's about a 9-minute clip. We're going to share some little pieces of it with you. Here's the beginning of it.
So I must say that I believe we stand about where in good company today, in halls such as this where your predecessors, where Dave Dubinsky himself actually stood, where another former president stood, and fought this issue out of Social Security against the same charges.
See, he's talking about Franklin Roosevelt fighting for Social Security right there in New York, talking to the workers.
This argument that the government should stay out, that it saps our pioneer stock. I used to hear that argument when we were talking about raising the minimum wage to $1.25. I remember one day being asked to step out into the hall. And up the corridor came 4 distinguished-looking men with straw hats on and canes. They told me they had just flown in from a state in their private plane, and they wanted me to know that if we passed a bill providing for time and a half for service station attendants, who were then working about 55 to 60 hours at straight time, it would sap their self-reliance.
Right.
The fact of the matter is, what saps anyone's self-reliance is working 60 hours at straight time, or working at 85 or 95 or $1 an hour.
Kick him upside the head, Jack. I mean, this is.
All depending upon filling out a pauper's oath and going and then getting it free. Nobody in this hall is asking for it for nothing. They are willing to contribute during their working years. That is the important principle.
This is the sales pitch for Medicare. We will pay for it throughout our working years, and it will be available when we retire. This is John Kennedy making that pitch.
I understand that there's going to be a program this week against this bill in which an English physician is going to come and talk about how bad their plans are.
Yeah, this is the Republicans organizing this.
But he ought to talk about it in England. Because his plan, and what they do in England is entirely different. In England, the entire cost of medicine for people of all ages, all of it, doctors, the choice of doctors, hospitals, from the time you're born to the time you die, are included in a government program. But what we're talking about is entirely different. And I hope that while
Kennedy is basically talking about single payer here. You can continue that.
While he's here, he and Dr. Spock and others who have joined us will come to see what we're trying to do. The fact of the matter is that what we are now talking about doing
with Medicare,
most of the countries of Europe did years ago.
Single payer.
The British did it 30 years ago.
That was nationalized health care. Actually, they started for elderly
We
as
are
well.
behind every country pretty nearly in Europe in this matter of medical care for our citizens. And then those who say that this should be left to private effort.
Like Ronald Reagan.
And those hospitals in New Jersey where the doctors said they wouldn't treat anyone, who paid their hospital bills through Social Security, those hospitals and every other new hospital, the American people, all of us, contribute 1/2, 1 or 2/3 for every new hospital in the national
we help
government.
build this infrastructure. You can keep playing it. I'll talk over it.
We pay 55% of all the research done. We help young men become doctors. We are concerned with the progress of this country.
This is a complete package here.
That what we are now talking about spoils our great pioneer heritage should remember that the West was settled with 2 great actions by the national government.
Pause that right there. This is John Kennedy. If you watch this, you will see he is not reading a teleprompter. They didn't even have them back then. And he's speaking without notes. Or at least he's not reading his notes. He hasn't looked down through the entire thing that you've heard. This is John Kennedy, President John Kennedy, talking off the top of his head, pitching Medicare. And this is why he keeps going into these digressions about the minimum wage. And here's now one about, how the pioneering spirit. And he's going to talk about, the land-grant colleges and things like that. So here it is.
In President Lincoln's administration, when he gave a homestead to everyone who went west, and in 1862 he set aside government property to build our land-grant colleges.
Like
this
Michigan
cooperation between an alert and progressive citizenry and a progressive government is what has made this country great, and we shall continue as long as we have the opportunity to do so.
Of course, now we have Trump who wants to undo everything. Not just John Kennedy's legacy, but even Franklin Roosevelt's legacy. I mean, he just wants to undo the whole thing.
This matter should not be left to a mail campaign where senators are inundated, or congressmen, 25 and 30,000 letters.
So this is when Reagan was doing his album about how terrible Medicare was, and they had organized this campaign. They'd organized this huge campaign, the mail campaign, all these conservatives, all these Republicans, to inundate the senators saying, don't do Medicare, it's socialized medicine. Back to Jack.
Half of them misinformed. This meeting today, on a hot, good day, when everyone could be doing something else, and the 32 other meetings, this indicates that the American people are determined to put an end to meeting a challenge which hits them at a time when they're least able to meet it.
Getting sick after retirement. This is a sales pitch for Medicare. Once again, keep in mind, this is John Kennedy pushing for Medicare.
And then finally, I had a letter last week saying you're going to take care of all the millionaires and they don't need it. I do not know how many millionaires we are talking about, but they won't mind contributing $12 a month to Social Security.
Which is how they were going to fund Medicare.
And they may be among those who will apply for it when they go to the hospital. But what I will say is that the national government, through the tax laws, already takes care of them, because over 65 they can deduct all their medical expenses. What we are concerned about is the person, not who has not got a cent, but those who saved and worked and then get hit. And then there are those who say, well, what happens if you die before you're 65? Well, there isn't. You really don't care. You have no guarantees. But what we are talking about is our people are living a long time. Their housing is inadequate. In many cases, their rehabilitation is inadequate. We've got great unfinished business in this country. And while this bill does not solve our problems in this area, I do not believe it is a valid argument to say this bill isn't going to do the job.
There we go.
It will not.
This is Jack Kennedy.
It will do part of it.
We can. In fact, I think we can end it there. That was Jack Kennedy, basically, making the case for Medicare, and it's pretty amazing. Now, meanwhile, we've got the wonderful congressman from Michigan, Bill Huizenga, and he's saying, people have to know about their health care prices, so we have to have health savings accounts, right? Here, in other words, don't just do away with Medicare, do away with all government health care, and, just let's go back to a system where you got to pay your own way. We'll let people have health savings accounts. Here he is.
Way too often, people are just, pull out their insurance card, and it's like I don't know the difference between and cost between an X-ray, an MRI, or a CT scan, right? I might make a little different decision if I did know what some of those costs were and those costs came back to me. That's why I think HSAs, health savings accounts, having pools of money that we put in as individuals and as families really can help us try to keep some of those costs down.
And here he is. We're going to run this right into the break. Here he is telling the story of how he didn't take his own kid to the ER because he wanted to save money.
I just had it. My youngest son went racing out the front door on his way to go to jump on the trampoline. I thought he was going to get injured going to the trampoline. He got injured on the driveway to the trampoline, fell, broke his arm, and we weren't sure what was going on. It was in the evening, and so I splinted it up and we wrapped it up, and the decision was, okay, do we go to the ER? We thought it was a sprain, but weren't sure. Took every precaution, and decided to go in the next morning. I mean, the cost difference. Certainly, if he had been more seriously injured, we would have taken
difference.
That doesn't become part of the
I mean,
question.
The cost
but
difference. Hang on, this is insane. This guy is saying he didn't take his kid to the emergency room with a broken arm because the emergency room costs more than going in the morning to see the doctor. And he wants all of us to be making these kind of, oh, gee, I've got cancer. Maybe I should just wait. This is insane. We'll be back.